very, very pleased that Michael's taken the time out of his very busy schedule here today to come and talk with us about the Duluth model. Michael will have you say a little bit more about yourself, but we want to let everyone know that Michael was one of the founders of the Domestic Abuse Intervention Program with the late Ellen Pence, our dear friend who passed away in 2012. And Michael was a core organizer with Ellen as part of what the Duluth model is. And we did this webinar today because in part there's just so many questions and thoughts and wondering what it is. Sometimes it gets lost in translation about what the Duluth model actually is. So Michael, why don't we have you get started? Just by introducing yourself, and then I'll just start asking you a couple of questions to get us moving along. So say a little bit about yourself.
Okay, very good. I just want to make sure you can hear me okay.
Yep, I can hear you great.
Okay. Well, again, I apologize to everybody for the technical problems on our end here, but thank you all for joining in the webinar. As Melissa said, I'm Michael Paymar. I've been in this field for, well, since the Duluth model started back in 1981. And I worked as the men's program coordinator and helped do a lot of the organizing in the early stages of the Duluth project. And then I went to work with the Battered Women's Justice Project for many years. And now I run a nonprofit called Education for Critical Thinking that's dealing with gender violence issues. So I'm very happy to be here and have this discussion with you about the Duluth model.
Great. So, Michael, we're just going to start out just with a little bit of a historical perspective today. Can you just sort of talk about the history of the Duluth model? You kind of give us a sense of, like you said, it started in 1981. What was it like back then? What was easy? What were some of the struggles? Tell us a little bit about that.
Well, I think it's always helpful to put this in perspective and talk about the reality of what was actually happening back in the early 1980s. I mean, think about it. In the 1970s, I mean, I didn't say this, but I'm a member of the Minnesota House of Representatives and have been there for almost 20 years. Well, in the late 1970s, state legislatures all around the country started enacting laws that criminalized domestic violence. And it really started there when Minnesota adopted a bill that allowed officers to make a warrantless arrest if they had probable cause to believe that a crime had been committed. So that was really the impetus, is changing the state law. But even though the law was changed, cities, by and large, were reluctant to get involved, were reluctant to change their policies or really address the issue in any fundamental way. And Ellen Pence and Shirley Oberg, you might remember some of these names, Coral McDonald and myself early on as a volunteer. We were looking for a community to try something different, to really take that law and make it work. And Duluth had, fortunately, some community leaders who were receptive to the idea, a police chief, a probation officer, a judge, that really thought that the idea of having a coordinated community response and changing policies to protect victims and hold offenders accountable made sense. So the very beginning, we went to the police department, and the police chief at that time was a little reluctant to change the policy. So there was essentially an experiment that was created where a third of the officers were told that they must make an arrest if they had probable cause to believe that an assault occurred. The other officers could do what they wanted, which was whatever their present practices were, and the third could either mediate or separate and then make the decision on whether to arrest or not based on that decision making. And it was very clear from that early experiment that if you left it up to the officer's discretion, that most of them would not make the arrest. So that was the kind of environment that we were really looking at from the very beginning, and it wasn't until a couple of years later that the police department finally agreed to adopt a mandatory arrest policy. So the police were really the first agency that we went to organize, but when you think about the domino effect, if you're going to make arrests, then you have to have a prosecution policy that makes sense. So the prosecutors were next in line to develop policies with the Domestic Abuse Intervention Project, and then of course the bench, probation officers, and then the mental health community. So slowly but surely each intervening agency got on board, and 2 years after this organizing effort agreed to policies, and a press conference was called, and hence the Duluth Model was formed.
Michael, can you give us a sense, like at that time, who some of those other agencies were? I mean, I have an assumption that some of the, what we consider the basic criminal justice agencies, but can you just sort of confirm that? And then were there any others, that maybe were a part of some of those earlier discussions?
Well, as I said, I mean, there's key players in any coordinated community response. So you have to get the 911 dispatcher online with the policy. You have to get, obviously, the police on board. The city and the county attorney, at least in our jurisdiction, we have a city and county attorney. The city attorney handles misdemeanor cases, and the county attorney handles gross misdemeanors and felonies. You needed to get the bench involved. I mean, one of the things that I think that we faced 30 years ago, I think a lot of jurisdictions still face today, and that's resistance. Why should we do this? And there were some difficult hurdles that we had to face. For instance, the judges were quite concerned if there was a mandatory arrest policy. What would they do with all these offenders who are now brought into the criminal justice system when there was so much jail overcrowding? So they asked the DAIP if we would organize the mental health community in Duluth to begin offender programs, so that in lieu of actually going to jail, offenders would have the opportunity to be on probation for a year and complete a counseling program. So you had the mental health community, you had the jail, you have the battered women's shelter, you had all of these different agencies that when you think about how you tackle a social problem, unfortunately, even today, everybody is in their little silos, and they develop policies and practices that make sense to them, but they don't communicate with each other in a very meaningful way. And I think that's what when I think back and look at what sticks out about the Duluth model and why it's been so successful over all of these years is that we didn't just bring everybody to the table and say, okay, we've got a problem here with domestic abuse, so how are we going to deal with it? I think that would have been a recipe for disaster. And in fact, we still do not do that. We have long believed that a nonprofit or an NGO, an entity that's not connected to the criminal justice system, should have the authority and the buy-in from the system. So when there are problems that surface, an interagency meeting can be called, look at the data, try to resolve the problems in an amicable way, and then, if necessary, change the policies to further enhance the safety of victims. So it's been that model that I think has made Duluth very successful, so that each one of those entities that I just named is certainly part of the solution, but we work with them on an individual basis. Sometimes, for instance, the police and the prosecutors might get together to discuss a particular policy, but you would never ever bring everybody together. So sort of a long answer to your question, but I really do think that that's what's, it is a lot of people, at least when I've done national and international training, say that they're doing the Duluth model or that they have a CCR, and when I ask more about that, I usually find out that what they have is a task force or some kind of coordinating committee, and they get together once a month and talk about problems, but I don't think that's a good way to resolve problems in the system.
Sure. And Michael, can you say a little bit, I mean, also, and I think maybe we'll get to this a little bit later, but I'm thinking about it now, which is that in part say a little bit about why, if you have a batters intervention program or a men's nonviolence class, why it's so critical you also have the coordination of the criminal justice agencies. Because I know that a lot of batters intervention programs kind of struggle with that, and so I mean, because I understand from you and being here in Duluth is that was the original intention. So can you just any additional thoughts about what the struggles would be if you were kind of standing alone, and what the enhancement is if you're connected to a coordinated community response?
You're talking about the treatment programs for offenders?
Yeah.
Yes. Well, let me just start off by saying, because I'm seeing the slide that's up there, unfortunately I can't see you or you can't see me, but the fourth bullet there about resistance, that's always a struggle when you make social change. And I think I mentioned the fact that the police initially were a bit resistant when we were talking about this Duluth model. For instance, the Chiefs of Police Association back in the 1980s said that the absolute wrong way to intervene in domestic assault cases is to make an arrest. That's the last thing that you should ever do. So that's sort of the environment that law enforcement was operating under. And again, think back to the 1980s, and in some ways it still exists today. Just the whole attitude about domestic abuse, that there's both people's share responsibility in the fact that there's domestic abuse in that household. So you have this sort of prevailing attitude about what causes domestic violence and then how do you end it. So some of the resistance that we encountered early on in the 1980s when the mental health communities got involved was how connected should they be to not only the Domestic Abuse Intervention Project, but also the criminal justice system. And I bring this up because I was just presenting at a conference in San Diego, the IVAT Council, which is the International whatever, on victim trauma assault. And I was on this panel, and there were two very, I think, respected researchers and practitioners in the field. And one of the questions that was raised was, does your program have a policy that says that you have to report back to the courts if there is if there's a violation? In other words, if someone is committing violence, if someone is violent while they're in the program, do you report them? And I said, of course, that's a fundamental piece of the Duluth policy and the DAIP policy. And these two individuals said, well, they don't do that. In fact, one of the people said that they would never do that because it shuts down the group. That who would ever talk about their violence if they knew that they would be reported back to the court. And I was thinking, like 33 years later, after we struggled with these very issues, that is still a contentious issue that's out there. And we've always seen that the counseling program, that the educational program in Duluth is really an appendage of the criminal justice system. So you have to have a policy that's connected that says if you use violence, you're going to get reported back to the court. Now, whether that person goes to jail or not is another question altogether. But you have to have accountability in your system, and so that's why I think that a tight, coordinated community response is such an important thing if we're going to make a dent in domestic violence, because the offender needs to know that he or she will be held accountable for their behavior, and the victim needs to know that the system, the entire criminal justice system, as well as human service providers, are doing the best that they can through policy as well as their practices to make sure that she's safe. So that, I think, is it's one of the issues that I think that we're struggling with nationally now about treatment programs. And I really hope that whatever treatment program that people think is effective, that at least at the very basic, that they are clearly connected to the criminal justice system in an accountable way.
And Michael, can you say a little bit about how the power and control wheel and the equality wheels, came about? Because it's that intricate. It's what people recognize often as part of the Duluth model. And can you just give a little bit about that?
Well, it's interesting.
Also, so just so you know.
Okay, yeah. It's interesting. The power and control wheel actually was developed by battered women who were in support groups at the Domestic Abuse Intervention Project, and I remember that I think it was primarily Coral and myself and Ellen. We'd go to these support groups, and we were asking women what were the most common tactics or behaviors that were used against them. So, for instance, the word intimidation might come up, and everyone would give different examples of the way their partners intimidated them, whether it was a certain glare or pounding on tables, slamming doors, screaming in their face. Then the conversation might be children. Yes, my husband has threatened to take the children away or gain custody of them unless I drop the assault charges. So we were looking at if you would have been able to go back to that time, we probably had 20 or so major kinds of tactics or behavior, but we decided to stick to the ones that you see on the power and control wheel because everyone seemed to have those in common. And so the wheel really was designed as sort of an illustration, if you will, to explain what battering is, so that you see on the wheel the domestic physical violence and sexual violence is what really supports the wheel. It's the rim of the wheel, and inside of the wheel are different tactics or abusive behaviors. So they're the spokes of the wheel, and then the intent is to maintain control in that relationship. So that's really an illustration of battering, and I've often said this, that I think that power and control wheel has been translated into 25, maybe 30 different languages, and when I've been traveling around the world, they have this wheel up in shelters and different community centers. But what it really illustrates is that it doesn't matter where you are in the world, the tactics are still the same. The intent behind the violence is still the same. The effects of the violence on victims and children are still the same. So that power and control wheel, I think, is a real powerful image, and it's sort of at the center of our work, I think, and also dealing with offenders, is to get them to see that it's for one, we want them to stop using physical violence, obviously, but unless they agree and recognize that the other abusive tactics on that power and control wheel can be just as terrifying and just as powerful and just as effective, if I can use that word, as the physical violence. I remember this woman telling me this story about her husband hit her once when they first got married, but he screamed in her face in this most powerful, horrible voice. And she said, 20 years later, he's never hit me again. But when he's mad at me, he uses that same voice that as he did when he hit me. And I stop. I shake. I stop whatever I'm doing. And he knows he's gotten what he wanted. So we have to recognize just the power of first the physical violence, but the rest of the tactics on that power and control wheel.
So, Michael, actually, we just counted here at DAIP, because we get requests from all over about using the wheel, and we just found out, I believe, 22 different languages around the world and 33 different cultural contexts around the world as well. So, and we had put up a map and sort of represented all over the world, and just kind of, I just want to, for a minute, just remind people that they can ask questions, and I'll make sure to get those asked to Michael if you have one, so feel free to do that. Remember to do that. But also just kind of along that line, so Michael, and I think maybe it's tied to a little bit about why the Duluth Model's men's nonviolence program or treatment program has been a bit controversial, in part because can you say a little bit about the sociological sort of approach a bit, and it not being just sort of an individual / pathological approach, and just kind of talk about that a little bit?
about the. Would you just repeat that again? I'm sorry, Melissa.
Say that,
About
I think that the power and control bill, as you said, sort of represents that you can see these commonalities all across the world. I mean, I remember one time when a group from China had come here to Duluth, and they had a translator, and they had headsets on, and so at one point they had closed their eyes while we were facilitating men's group. And one of the things that they said afterwards was that they wanted us to know that they weren't being disrespectful, but they were closing their eyes because it was as if they were back in China, because the men in China were saying so many of the same similar things about the women in China as they were in Duluth. And one of them asked, have the men in Duluth sent a brochure to the men in China about how to treat women? I remember that was one of the questions, sort of jokingly, but also seriously. So can you talk a little bit about the thinking and kind of where you started as it related to the name of the curriculum is creating a process of change for men who batter, but kind of just take us to that place and kind of how you got to where you are and why you're there.
Sure. Yeah, good question. I was thinking about just the changes that we went through over the years. Back in 1981, when I got involved in the program, we had what was called BA. It was called Batterers Anonymous, and that was the one of the treatment approaches that we had. We then brought in Dr. Ann Ganley, and she trained the DAIP staff and myself on anger management treatment. And then it sort of dawned on us in the mid-1980s that something was amiss. Primarily, we were doing anger management, and we had some of those BA elements in there or AA elements, and so we'd have a lot of people that would talk about their personal problems that they were having during the week, and that would occupy a period of time during the group. But they never really talked about their violence. They never really talked about their beliefs. And then when the anger management techniques started to become infused, what we kept hearing from the men is, I have a short fuse. I lost control. My wife provoked me. If she hadn't said this, I wouldn't have got so angry. So everything became focused on his anger and how to control his anger, so when he got into a similar situation in the future, he wouldn't use physical violence. And this was all buttressed, obviously, by the cycle of violence theory that sort of said that, invariably this would happen in a relationship where there's violence, is that men would get more and more stressed out and more tense, and eventually they would reach this crescendo and they would batter their spouse, and so that the idea was, if we could just teach anger management and timeout tools, that men would stop their violence. And well, I think that there's a place for timeouts, and I recommend them. A man is, if their intent behind the violence, and here's where I always think it's really fundamental. I always say that there's really three very basic reasons why a man uses physical violence in the relationship, and that is to shut her up, to stop her from doing something, or to punish her for something that she's done. And the more we get into a lot of these different psychological theories, I think we lose sort of the fundamental reason for why the physical violence is occurring. So when these people from China were saying that it sounds like the same men here as the men in China, what we're really dealing with is a long historical roots of patriarchy and of men's violence against women to control them, to dominate them. And I know a lot of people don't want to hear that kind of analysis, but it is true. It is true around the world, and in some countries even more so. But when you're thinking about battering and the function behind it, if it is to dominate someone, and I wouldn't say that all physical violence in a relationship is the same. Not everyone who uses it is attempting to batter or dominate their partner, but when they are, there is a certain belief system that individual batterer has that is shared by thousands and hundreds of thousands of men throughout the world, and that is a belief in superiority, that men are better than women on some level, that they're more logical, that they're more intelligent, and that they get to be the boss. I mean, all groups who oppress another have that fundamental belief. And once you have that belief, the second key element is that you get to objectify that person. And you do objectify that person because it's much easier to beat someone who ceases to have humanity. So you'll see that a lot of men who batter, when we talk about emotional abuse, I mean, that almost always precedes the hit, the punch, the dragging around the floor, is the sense that you're a bitch, you're a whore, you're not a woman, and you're a bad woman, and therefore the more he uses this degrading and humiliating language, the easier it is for him to use physical violence. And then the third key element here is sort of this forcing her to submit, getting her to believe that she's less than in the relationship. And the final key element is that when using violence with impunity, and you see this globally. You see it in the United States, of course, but in some places around the world, if you can't even call the police. They will do absolutely nothing if there's domestic violence. So we have this long history of gender violence around the world, and it's just in the last generation or so we've started to address it on a fundamental level. But these beliefs die hard, and it's part of patriarchy, and it's really a key piece of what we're trying to do also in our men's groups is to get men to think more critically and reflectively about these kinds of issues. What is it that you want a woman in your life for? Your own role as a man in that marriage, and your own sense of masculinity, and what you think you're entitled to. So this is not a Duluth issue. It's not an issue just for America. It's a global issue. And we have a lot of work to do.
Right. Can you say about, you kind of covered a lot of these bullets here, but can you say why a lot of what you've just said is kind of controversial? Can you just say a little bit about that?
It's controversial because there are a lot of practitioners in our field who would offer the following argument. They would say that women are just as violent as men. I think that's one of the key. I don't know if it's a key argument, but it certainly is a major argument that we're having in the country today. And a lot of that goes back to the Strauss research that was done over 30 years ago, where women reported using violence in equal numbers with men. And so a lot of people who subscribe to this gender symmetry argument are saying that it's really unfair that these pro-feminist kinds of groups like Duluth and Emerge and others around the country that have this analysis when women are equally as violent as men. And I think that what we struggle with is to try to say that I'm very clear about this. Women use violence. And Melissa, you've done work in this area, but women use violence. They use violence in self-defense. They retaliate when violence gets used against them, and some women actually initiate violence. But I think that when you think about the power and control wheel again, and you think about those kinds of tactics that really describe battering, there's not that happens very infrequently, where a woman uses those kinds of tactics on the power and control wheel and can instill that kind of fear and terror in her husband or boyfriend. So the numbers really, in my estimation, pale in comparison, and they also don't take into consideration the context of how the violence gets used. So this is sort of the argument that we have is women's violence, and putting that into perspective and into a context that makes sense. So that's one of the big arguments that we hear. Some people would say that we should be focusing more on anger management, and I think I addressed that a bit. There are other people that say we should be focusing more on substance abuse, and I would agree. Over 50% of the men that usually come into our program have substance abuse problems, but because they really have two problems that need to get addressed. So there's a lot of practitioners who think that Duluth is too focused on trying to change beliefs and attitudes in men who batter, and that especially if the couple's going to stay together, they're advocating for more individual therapy and certainly more marriage counseling. And I would say that I have nothing wrong with marriage counseling, but I don't think that we should be offering marriage counseling until the individual has completed a domestic abuse program, B, the victim feels safe, that she can talk freely in therapy, and has worked with an advocate, because a lot of women do want to stay with their abusive partners. So you have all of these different arguments out there about what causes the violence. So that there's different philosophies about this, and then there's an equally corresponding number of arguments about what stops the violence. And I think that's where we get stuck a bit, is should we offer marriage therapy? Should we have anger management classes? And then, of course, you have this current argument about evidence-based work and the research that's out there. And a lot of people would say, well, your program doesn't work. Or they say, even more troubling, I think, is the Duluth model doesn't work. Well, let me just say here real quick, Melissa, I know you have other questions, but there's two fundamental problems with that statement. Is A, people by and large don't understand what the Duluth model is. The Duluth model is not a treatment program. The Duluth model is a process where an NGO works with community agencies to confront domestic violence by developing policies that enhance victim safety. That's fundamental to the Duluth model. And so people confuse the Duluth model and say, well, it's the treatment program that's the problem here. And so I remember Ellen telling me, years ago, that all of this debate and all of these arguments about which treatment program works or doesn't work, she said, at the end of the day, this whole fight that we're having about treatment is just going to be a footnote in history, because what really will be historical is that in the 1970s and the 1980s was when state legislatures throughout the country enacted laws that said that wife beating was illegal. And so we'll probably have this argument about what treatment program works or doesn't for another 10 or 15 years. But I would argue that the key principles and the guiding principles of the Duluth model around victim safety, offender accountability, creating a community deterrence to domestic violence are far overreaching over whether the Duluth model or any other treatment program for offenders is effective or not, because the people who criticize the offender program, their models aren't any more successful when you look at the numbers. And in fact, if you look at Gondalf's research, programs like Duluth that use the cognitive behavioral treatment model and have a tight coordinated community response are more likely to have less recidivism than those that don't. So I think there's a lot of arguments, and I'm obviously a Duluth booster, but I think there's a lot of fundamental arguments to be made for why this is a good approach.
Great, thanks, Michael. So just to get to a couple questions here, and I did answer one of them in the queue, but one of the questions about women being ordered to Betters Intervention programs. So I did respond all to that. So if you have additional questions about that, you can send in a different question. So part of it is that there's a question here about, or a question in the comments saying that a lot of people in this person's state, we'll just say on the West Coast, use the term Duluth model to identify a treatment model for working with domestic violence perpetrators rather than the collaboration model. So what we've kind of been talking about, but in a sense, they kind of want some advice, essentially, about how to explain about, you know, its difference to their community and about why the other pieces are, you know, are so important. And I know you touched on this a little bit, Michael, but, you know, in essence, I think it's also about kind of tied to the rest of the system and about the pro-prosecution policies as well, you know, that are today and mandatory arrests and kind of what we've learned. But, you know, I think back about when we had done at Praxis with Ellen, we'd done a focus group with battered women, just give an example. And this focus group was with women who their partner's criminal case was either 3, 6, or 9 years out, right? And we had said to them, the question was, tell us about, are you glad or not glad, or where you are in your thinking about the criminal justice system responding? And tell us what your response was at the time. And overwhelmingly, battered women said, you know, the thing is that I was calling the prosecutor, calling the probation officer, everyone, begging them to drop the charges, and you know, and some of that I was being coerced to do. But also, what they said was, in the end, they were so glad that the criminal justice system held them accountable, because their reflection was that there's just no way that they could, right? Because there's also kind of this thing of still that some people think it's a private person's business. But can you just comment a little bit more about why this is so important? And then there was another question there about, it's kind of like, I need the 3-bullet answer about what is the Duluth model. So if people were asked, you know, kind of what it is, kind of. So basically, we have local advocates in communities around the country, Michael, right? So what's kind of, is there a short answer to what the Duluth model is that you might be able to give to the listeners?
Well, yeah, a short one is hard, but I do think that this, you know, when people talk about the Duluth model, I mean, I would just say, like, a Duluth model, the Duluth model really is having an effective and efficient coordinated community response where agencies have built into their policies concrete measures to measure the risk that a victim faces and what would be in the best interest to hold that offender accountable. You know, I'm not a big believer in long prison sentences. As the chair of the Public Safety Committee at the House of Representatives, I'm not sure that you know, filling up our prisons is really the best idea when we can offer people an opportunity for rehabilitation. So I would just, you know, tell people that you know, that the CCR is really the key element of it. And I think that the other thing that is important, and I remember early on that this was one of the things we had to convince Duluth interveners, judges and prosecutors and probation officers, and through our training, that what was important is that they really need to understand the power differential between men and women when there's been domestic violence, and I think that gets lost. It certainly does on the line off police officer, for instance, who goes to investigate a domestic. You know, they're going to see men and women acting out in all kinds of ways when they get to that household. But if you're trained and understand the dynamics of what's going on, you're going to understand that a little bit differently, and you're going to recognize the kinds of control that a batterer can have over a victim. So when I think you were mentioning earlier about a pro-prosecution policy where victims, where the charges are not dismissed very easily, that all plays into that whole philosophy is that there's so many forces that a batterer can use, not just power in the relationship, but power in the system to get the victim to drop charges, to not show up at the hearing, to not testify. I mean, the fear of physical retribution, the fear of losing your children, the fear of being left penniless. I mean, there's a whole lot of reasons why a victim responds the way she does when she's in a very difficult criminal justice system to maneuver. So I think that, you know, that tight CCR, understanding the power differential and making that come alive to people in the system of what that looks like and why the victim and the perpetrator are acting the way they are. And then I think, finally is that, what works when you think of any social problem, what works? And our thinking has always been, and whenever you confront a social problem, which is why I think cognitive behavioral treatment is so effective, is that you really have to start helping men who batter understand, become more reflective about their own thinking and their beliefs, and that is really the underpinning of the Duluth curriculum is that if he doesn't change his beliefs about women and using violence to settle problems, he's going to continue to batter her. It doesn't. You could put him in therapy. It's not going to make a difference because he's not in a place where he can be reflective on that kind of level. So I think at the very basics, you need to help men understand the intentionality of their violence, where those beliefs come from, what the effects of that violence are. One thing about domestic violence is it's very effective. It gets you what you want. But I think when I've worked with offenders over the years, I've always said, you get what you want when you use physical violence. You might shut that person up. You might stop the argument. But eventually, you're going to drive her away. No one wants to be battered. No one wants to be humiliated. And she's going to resist you. And at the right time, she's going to leave that relationship. And so I think that we want to present that dilemma in our men's groups. And I think if you could sort of explain that to systems people, maybe I'm being a little too convoluted here, but I think those three elements are key to making change and making her safe and making sure that he's taking responsibility for his behavior.
Yeah. So, Michael, kind of tied to what you were just talking about, there's a question about, there's kind of this belief that once an abuser, always an abuser, and, this person saying in their community, they're basically they're not even really referring to batters intervention programs anymore because of lack of success per se. And so, but what I did hear you say earlier, and kind of know myself, you said that there's no data or any evidence that shows that anything else works as well. Do you want to add to that? I'm just kind of reiterating to the question, but I want to see if you want to add anything to that at all.
Yeah, I guess I would go back to the statement I made earlier when Ed Gondolf, who's one of the preeminent researchers in our field, did his four-city research and found that 5 years after an offender had gone through the treatment program and completed, that 70% of these offenders were not using physical violence. That's a pretty significant number. And this wasn't just rearrest. This was talking to partners about changed behavior. So I think that a lot of the research out there is skewed for a lot of different reasons, because some offenders quit the program. But if the people who complete the program and who stay in their relationship, the recidivism level is quite low. Now, I would argue that there is a small percentage of offenders, probably 20–25% of offenders, who are going to continue to batter and continue to batter other women when they get into new relationships. So we may have to be thinking more strategically about how do we contain that group of offenders. But let me just correlate this to other social problems. I mean, when you think about the success of substance abuse treatment, for instance, I think it's about less than 50% of people who have drinking and drug problems are going to be, quote, successful when they get out of inpatient or outpatient treatment. So we have these, I think, incredible expectations on what a batter or treatment program is supposed to accomplish. So we really have to think about what is the end goal here, and part of it is to create a community deterrence from further acts of physical violence. And so I just think, if that question is asked of you as an advocate or a domestic violence worker by a judge or a prosecutor or the news media, well, none of these programs seem to work, so why should we invest money into them? I would just flip the question, because I deal with this all the time at the state legislature when they ask about outcomes. Well, what would you do in its place? What alternatives do you have? If you don't offer people a means for rehabilitation, are you just going to put them in jail? I don't think that that's the answer. So, we're going to struggle, I think, over the years trying to figure out what models have a little bit more success. But at the end of the day, I think that the argument is a bit moot, and I would always just flip the question as, then what would you do with them? And they're not going to have a good response.
Okay. And so, part of what we want is kind of in our last bit of time, the last 10 minutes or so, or under 10 minutes, is kind of think about kind of the future and thoughts about the domestic violence field and, why the Duluth Model is what we have a pioneering approach. And, in part is that, the Duluth Model just got this recognition. Michael, you went to Geneva, Switzerland recently to accept the award for the world's best policy to end violence against women and girls. And from the United Nations, and part of that is because it can be replicated, pieces of it around the world. But, think in terms of like moving forward, kind of where we've been with the work. Like one of the pieces, in terms of the approach and thinking about doing the actual group piece just for a second, can you say a little bit about the approach and if you've observed groups that other people have done? So, for example, Michael, there's kind of this push about when doing groups about teaching people things, but really doing it in a way in which we're telling people how to live their lives. And the Duluth Model and its process work, is very, very different, and that's the piece that rarely ever gets captured. So there's that part of it. But also as well, there's a lot of programs that are starting up, for example, online, and, that's kind of a new wave and move. So can you talk a little bit about, in terms of the men's nonviolence class, a little bit about the process part of it and kind of where you see the field is going?
Yeah, excellent question, Melissa. And I'm glad you asked it because I'm trying to do this. I'm missing so many things, but I think that Ellen and I really struggled developing the curriculum back in the mid-1980s, and we brought together the late Susan Schechter and Barbara Hart and Joe Morris and Miguel Gill, some of the key people around the country that were doing this work, and we had this curriculum, Ellen and I had developed, and we were so proud of it because it dealt with all of these different causal factors for domestic violence. It dealt with stress, alcoholism, childhood trauma. We had a whole list, and at this we went out to this cabin and we looked at the curriculum, and everyone was just sort of dissatisfied with it. And we were saying, "What's wrong with it? We worked so hard," and I think it was Barbara Hart said, "I think we just need to come down to the fundamental question here is, why do men batter?" And we came to this conclusion that men who batter because they want what they want when they want it. And so it's that whole sense of entitlement, and where does that come from? And I talked a little bit about sort of the philosophy of oppression. And what we borrowed a lot from when we created the curriculum was from the late Brazilian educator Paulo Freire, who really helped us understand that if you engage people in dialogue, that they will think more critically and reflectively about their lives. And so much of that curriculum is based on his teaching. And I actually was educated as a teacher, and Freire talks about the way I was educated, and he said it's called banking education. In other words, you impart certain information into that person's head or that student's head, and they repeat it back to you. Well, that's the way a lot of programs operate, but they really don't help the student, if you will, think on a deeper level. So what the curriculum, if you use it correctly, and a lot of people don't or don't know how to, but if you use it correctly, you are able to ask probing questions of the men in the group that you're not blaming, you're not shaming, but you're really curious as a facilitator why this person thinks the way they do. I mean, if someone says there can't be two captains of one ship, where does that belief come from? Does it come from society? Does it come from your family of origin? Where does it come from? Help us understand where you got that knowledge from. he might say something, and then you'd ask him another question. But it's that process of dialogue and engaging men and believing that they have the capacity to change their thinking and beliefs that I think is really quite fundamental. So that's the first part of your question. There was another part that I missed.
What about the online sort of, that's kind of
Oh, yeah.
where it's going. Can you say a little bit about
Yeah,
that?
I'm very, very fearful. I drafted and got past the state statutes here on standards for domestic abuse programs in Minnesota, and I'm just chagrined by what's happening in my own state, which I always think is so progressive, is that you can actually take an 8-hour online anger management class and satisfy your probation conditions for treatment. And this is not just in Minnesota, it's going on all around the country. So I just think that there's people that are unfortunately making money off of this, but they're really not providing good services. And change and transformation takes a long time. Now we can argue whether a 6-month program or a 52-month program is better, but it takes a long time, and the process is very challenging. The group should be very challenging. So I don't know. Necessarily, state standards are changing, as we speak. But I think that there should be some basic principles and philosophies and policies that batterer treatment programs should abide by. And I mentioned one earlier about reporting back to the criminal justice system, for instance. But it's also like having a philosophical understanding about this issue. I mean, if you believe that what you have here is a communication problem between men and women, or if you believe that that the offender in your group has an anger problem or has abandonment problems, I mean, you're going to reach them and provide treatment based on those different theories and that philosophy. And I would submit that the issue is much bigger. And the men that I have seen who have been successful in changing their behavior have been those men who have really struggled with these concepts about masculinity, about what they were taught about men and women, this sense of entitlement, and then I think the bottom line is that you can have a respectful, egalitarian, intimate relationship with a woman. And I think that we need to put that out to men who are ordered into our programs or who volunteer into our programs, that it doesn't have to be this way. Every batterer that I've ever met has been an unhappy guy and has not been, provided the kind of role modeling for their own children. And I think we need to put out some ideas and about a different way of being. Which is also, before we end, I want to just say that I really do think that prevention is going to be the next frontier, and I know there's some innovative things going on around the country, but I really believe that men and men who go through our programs should get actively involved in engaging men and boys about this whole social issue, because it is our culture that creates men who batter, creates men who rape, and creates men who buy women for sex. And all of these intervention models are successful up to a point, but until we really change the culture in which we live, I think we're still going to have a major struggle on our hands.
So, Michael, I just want to acknowledge that it's 3 o'clock on my clock right now. We did say 60 minutes, so because we started at 2:06, I'm wondering if we could just there's a couple really important questions that I know, I want to acknowledge, take a lot more time, but I do think they're worth at least asking and bringing up that people have asked here. And one of those is that the person says, I've observed that using the criminal justice system as a primary intervention can result in drawing poor communities and communities of color into the system disproportionately. How do you address this lack of fairness within a CCR? Could you just give us just some initial thoughts about that, knowing that we don't have enough time to sort of, take this to the full discussion it deserves?
Yeah, that is a problem. I would be the first one to admit it, that when I I've always been a strong believer in mandatory arrest policies, but you know, whenever you're involving the criminal justice system in anything, there are going to be unintended consequences, and I think this is a big one. That you know, in communities of color, you're going to have a fair amount of distrust of law enforcement. In immigrant communities, you're going to have women who are going to be reluctant to call the police because you know, fear of being ostracized by their own community, but also fear of deportation and fear of the police, depending on what country of origin they came from. So there are a lot of issues that I think are problematic, and so whether you have a program started or you're starting a program or trying to enhance your programs, I think it would behoove you to involve communities of color and immigrant communities into what kinds of policies need to be in place to address this issue. You know, I would just, you know, add is that, you know, sort of like this question about, you know, what's the alternative, and I think that would be that's part of the dilemma. So if you say, well, you know, this is that too many black men or too many Hispanic men, Latino men are going to end up in the criminal justice system with this kind of model, I would say, well, then what is the alternative? Which is a difficult question, because do you not want women to be able to call for assistance if they're being battered by their husbands? But you know, there is a broader policy there about, you know, what would it take to make that community safer, and make sure that offenders who are brought into the criminal justice system are treated properly. We see this around the world too, where there's, you know, a lot of people think that our arrest policies in the United States make sense for domestic abuse offenders, but what if you have massive human rights violations in your jails? So it's a complicated issue unless you bring people who are most effective to the table to help them sort through what kind of policies would be best to prevent some of those things from happening. Mm-hmm. We could probably spend an hour on that one, but that's sort of the short answer.
Sure. I just want to add to that, Michael. I mean, part of the CCR process as well is to do some monitoring and some, you know, case review. And so I know that that's what some communities have done, is they've said, you know, let's sort of take a look at what's happened here. I remember an institutional audit that was done actually in Minneapolis that looked at that. They actually wrote a big paper on it about how it ended up happening that way. And one of the things that they found out was that the way they organized their police officers was to do high-level patrol in the areas for which there was a high level of crime. Well, it kept sending them back to the same neighborhoods over and over and over, right, by this practice. So inherently, in this community, you know, had a large population of black men, and you know, and black families, and so it just ended up happening there. So I think that the institutional audit model as well can help sort of uncover some of the practices that bring this up. And then, of course, we never want to underscore the racism that happens, you know, in this country at levels that, you know, are still disheartening, at least to myself, I'll say. But yeah, I just want to thank you for acknowledging a complex question in a short amount of time. We are coming up to the end. So, Michael, I just want to, you know, there's a number of other questions here we're not going to have time for today, but we are going to invite you back. And can you want to just end with a few thoughts and words, just kind of thinking about this last hour of time?
Yeah, well, first of all, let me thank you, Melissa, and thank the DAIP for putting on this webinar, and for everybody who joined. I apologize for the technical problems. I would have, let me just say, you know, I've been in the field for a long time. I, you know, wear two hats as a politician as well as an organizer and a practitioner, and you know, you know, as much criticism that's out there, I think that we really have to, you know, take a broad historical look and recognize that we have really made some significant progress. I mean, you know, it's easy to get dismayed. You know, we in Minnesota, anyway, we had a real spike in domestic homicides this last year, and you keep thinking through, well, what mistakes have we made, and how could we do things better, and did the system fail? And On the other hand, we've just seen some dramatic changes. There's more services now, even with limited budgets, than there ever were for victims of domestic violence. I think we know more about the issue. I think more that there's better training now for people in the criminal justice system, law enforcement officers, on how to intervene. So, you have to take a look at historically, and in 30 years we have made some significant progress, and domestic violence has actually declined. And I am just very excited about the thought of really moving into this prevention field. I just really believe that that's going to, if we're ever going to really make some significant changes in ending violence against women, that's going to be the next struggle. But I guess a fair amount of people joined this webinar, and that says they care. That says that they're doing good work, and we just have to keep engaging in a powerful dialogue, and we will see change.
Great. Thank you, Michael.
Thank you.
I want to thank everyone who's on, and just on this last slide, Michael, I just want to say that he started a new nonprofit, and that's kind of where he's at right now, Education for Critical Thinking, and you can find that website. It's on this last slide here. I want to tell you that this is being recorded and will be up on our website, as well as the PowerPoint, so that'll be available there. We want you also to know that we are going to be doing Duluth Model training, actually here in Duluth, June 9th through the 12th. Wanted to say it's going to be an experiential training, meaning that we're going to have lots of opportunities to experience, for example, our 911 dispatch center, doing ride-alongs with police, observing criminal court, meeting with prosecutors, judges, observing men's groups. So we encourage you to consider that as part of learning more about the Duluth model. And also just want to say that, the Duluth model, in part, is a bit of a philosophical way of thinking, and so if you're interested in all the details of the description of it, it's also available on our website at www.theduluthmodel.org. So I want to let you know that our plan here at DAIP is to offer 3 to 4 informational webinars like this one per year, and then and those are free, of course. And then we'll be doing some training ones for those of you that have attended our trainings. We'll be doing some follow-up training ones for a very small fee if you've attended a training here at DAIP or would like some additional training. And I think because of your popularity, Michael, we'll probably have you back. And so thank you for your time, because I know you're very busy at this time of the year, and just want to thank everyone for being on here. I put my email on here, executive director at theduluthmodel.org. So if you want to contact me with some of those questions to follow up with, I'm happy to do that as well. But thank you for your time, and have a great day, and we'll end the webinar now.